and thank you for joining us. Our topic for today is um, adult attention deficit hyperactivity. And
Perry, I don't know
so,
what happened to your slide. Your slide deck is missing.
is it there now?
Yes,
Okay. And can everyone hear me?
yes.
Okay, great. All right. So let's begin. Our topic for today, of course, is adult attention deficit hyperactivity disorder. And to give you a little bit of background, let's look at what we're going to be discussing. Our overview begins with the introduction defining what attention deficit hyperactivity is. We'll look at the symptoms, the diagnosis, the cause and effects, treatment, and then goals. Those goals we're looking at are for ADHD month. That's going to be celebrated in October. And then we talk about the ways to show your support during the ADHD month. So, without further ado, and I please forgive me, I have a very active dog that's disrupting my class. Um, so, when we talk about ADHD, there are a lot of things that people don't know. One study estimates that 4.4% of all of the American adults in the United States have ADHD, while yet another study says that 8.1% of all adults in America will experience some of the symptoms at some point in their life. ADHD is a disorder that affects us all, whether it's us personally, whether it's a family member, a child, a friend, someone we know is affected by ADHD. And so it is a well hidden secret, if you will. And people don't realize just how many lives are impacted by ADHD. So, when we look at what ADHD actually is, it is a mental health disorder that includes a combination of persistent problems. And these problems include inattention, specifically inattention to detail, hyperactivity, and impulse control. Another term that was used is um, hyperactivity, boundary discrepancies, and impulsivity. Those all mean the same thing. And these various symptoms are what are categorized as ADHD itself. So, when we talk about these symptoms, there are three major symptom categories. Those are the inattention, that's the difficulty or the inability to pay attention. The individual is daydreaming, zoning out, they're overlooking details. They have a difficult time managing their time, their attendance. There's hyperactivity. That's generally too much energy or moving around too much or talking too much. When I first started looking at ADHD, adult ADHD, and I started thinking about those symptoms, I was checking off the boxes about talking too much. I've been told I'm a rather chatty individual. But that doesn't necessarily mean that because you're a very talkative individual that you have ADHD. It is a combination of these symptoms. The third is impulsivity, acting without thinking, having difficulty maintaining self-control. Individuals with ADHD tend to act rather than react, and their responses are instantaneous, and they look for immediate gratification. If I think it, then I want it. If I want it, I'm going to have it. So, additional signs and symptoms include their inability to maintain daily function. This interference in their daily activities can cause difficulty paying attention and often getting distracted, disorganization, and procrastination. They wait to the last minute to try and get something done. They don't have the organizational skills to multitask, and therefore it causes this disorganization, it causes frustration, it further exacerbates or increases their distraction. Poor time management, planning, and organization. These are some of the key symptoms that we see in adults. They have trouble remembering daily tasks. They're frequently losing things or being forgetful in the middle of an activity. It was like going to the refrigerator and then going, why did I come to the fridge? Frequently interrupting others or being extremely talkative. These are all signs and symptoms of ADHD. Now, when we look at additional symptoms, trouble focusing on large tasks or multitasking, as I said. Generally, a person with ADHD will initiate a task, and but before they complete that task, they've started another task. They've moved on to something else. They have trouble following instructions or finishing their projects, as I just mentioned. Difficulty sitting still for long periods of time, and often moving frequently or fidgeting. They have feelings of restlessness and a need for more constant activity or stimulation. As I said earlier, choosing immediate rewards over future rewards or even consequences. Many people show some of these behaviors some of the time, but for some adults with ADHD, they're more severe, more frequent, and more persistent in interfering in their daily lives and daily activities. And these occur across multiple situations and last for a minimum of about 6 months. ADHD also co occurs with other mental disorders and can make it even harder for those other disorders or ADHD to be treated. For example, sleep problems are especially prevalent, affecting over 70% of the adults with ADHD are insomnia. Symptoms continue into adulthood for many people with ADHD, but they may change as an individual ages. For instance, as in adults with ADHD get older, the inattentive symptoms start to persist, but the hyperactivity and the impulsivity start to decline. Adults with ADHD also have a history of poor academic work, work problems, strained relationships. They may find it difficult in challenging situations to stay organized, to stick to a job, to keep appointments, or perform daily tasks. And completing large projects can be a very daunting task for an adult with ADHD. They may be restless, trying to do multiple things at once, or engage in risky or impulsive behaviors. For example, an adult with ADHD might be given a large task. They feel they are overwhelmed because they're unable to multitask, and therefore they decide rather than completing the task, they're going to hide or lie or discredit part of the responsibilities to completing that task or project. ADHD is considered a developmental disorder because the symptoms always begin in childhood. They may not be identified until an individual is an adult, but ADHD initiates in childhood. So, how is ADHD diagnosed? Well, in childhood and in adulthood, it's a little different. Adults may have shown some symptoms as early as before the age of 12, which usually hits somewhere around puberty. The main difference between diagnosis in adults and kids is the number of symptoms. Adults or adolescents, those over the age of 16, have got to show 5 symptoms, whereas in kids, 6 symptoms of attention deficit. So it's all surrounded around the hyperactivity and the impulsivity of the individual that helps to clue into the diagnosis itself. So, a medical or physical or neurologic developmental exam is what helps to identify whether or not an adult meets the criteria for the ADHD symptoms, which again include that hyperactivity, that inattention to detail, or impulsivity. Recording symptoms using a rating scale and other sources of information is what helps to make a diagnosis and determine whether or not a person meets this criteria. So, what causes ADHD? Well, the exact cause is not known, but we believe it's a combination of both our genetic and environmental factors. ADHD is hereditary, and many people with ADHD have relatives with the same condition. Environmental factors can include brain injury, exposure to toxic chemicals, pregnancy complications to include alcohol, drug use, and smoking during pregnancy, and difficulty during delivery can also be an environmental factor that can cause ADHD. Poor nutrition and lead exposure have also been known to be a factor in the development of ADHD. So, what are the effects? Well, ADHD can affect your social interaction. Adults with ADHD can make it difficult to interact socially, and this can cause frustration both for the person with the ADHD and the individual that they're trying to interact with. School and work performance can be difficult because they're unable to multitask. They lose focus quickly, and it can lead to poor time management and lack of organization. Regarding the difficulties associated with employment, ADHD can make it difficult to keep a job, as it can be hard to meet the expectations of the employer. We know that the employer expects us to be attentive, organized, and on time. And all of these things can be very difficult for an individual that has ADHD. ADHD can cause financial problems. It can lead to things like impulsive spending, draining of bank accounts without acknowledgement of the consequences. It's that immediate gratification rather than the long term results or effects of their actions that cause problems for them. Some additional problems that occur with ADHD is relationships. ADHD can lead to unstable relationships. Not everyone is built or designed to deal with the issues of an individual, especially an adult that has ADHD. We tend to be more lenient or accepted of a child that fidgets or has a lack of attention to detail or even that impulsivity. But as adults, it makes it very, very difficult and can affect their relationship with families, spouse, coworkers. And ADHD can lead to poor mental and physical health and can be linked to depression, anxiety, self harm, and even suicidal ideations. It may also lead to alcohol or substance abuse. They have both been linked to attention deficit hyperactivity disorder. And individuals as adults that have ADHD can also be linked to more frequent automobile accidents or on the job accidents. Again, it's the lack of attention to detail, the inability to focus. Sleep issues are another effect of ADHD. Many individuals that have ADHD have an increased risk for snoring, sleep apnea, restless leg syndrome, and can also disrupt the body's circadian rhythm, making it difficult to fall asleep, to stay asleep, and to wake up at regular time intervals, which again then means you're late for work. So, how do we treat ADHD? Treatment for ADHD can include a combination of elements. These elements can include medication, therapy, and lifestyle changes. Some of the medications that individuals are prescribed that have ADHD are stimulants. They work by increasing the brain's chemicals that help focus, attention, and thinking. They can be a short acting or a long acting stimulant. And it is the decision that is made between the individual and the physician that makes the determination on which prescription is best for that individual. There are therapies such as psychological interventions as cognitive behavioral therapy that can help adults with ADHD. For kids or for children, behavioral therapy and parent training can be very important because even if the child is put through cognitive behavioral therapy, the parents have to know what to do and what to expect. Other treatments for ADHD are lifestyle changes. Exercise can help with ADHD, and you can try to incorporate this into your daily routine. Spending time in nature, meditating, these can all help to reduce some of the symptoms and to increase your focus. Cognitive training are programs that help specific functions such as attention and memory. Things like crossword puzzles, word games, and even coloring books have been known to help individuals with ADHD. Neurofeedback. Neurofeedback is a non invasive technique that uses an electrical device to monitor the brain activity, and then it provides feedback to help with self regulation. There are complementary health approaches. Some of those health approaches to manage ADHD symptoms can be things that combine different types of treatment. Some people may need to use several options before they find out what really works for them. And a specialist, like a psychiatrist or a neurologist, can usually arrange for these types of treatment. When we talk about ADHD Awareness Month, this awareness is celebrated in October of each year. And the goals of ADHD awareness is just that, to raise awareness to ADHD, to reduce the stigma of having attention deficit hyperactivity disorder, highlighting the resources and support that people with ADHD have available to them, promoting early diagnosis and proper management, and creating a more inclusive and compassionate world to address the issues associated with ADHD. Now, how do we show support? Well, one of the ways we can show support is during the month of October wearing orange. Orange is the official color of ADHD. And I'm not talking about, you know, orange is the new black. That's not what I mean. But we want to embrace ADHD as a disorder, a need to help individuals in the workforce, in relationships, and with their own control. Hosting or attending local campaigns and events to support ADHD is vitally important. And then planning an ADHD walk or community event can help to support those individuals with this disease. Now, I know the presentation seems short, but there are several questions that were asked that we feel like we can address that will help better cover some of the information. Your questions that were provided provide us the ability to provide a little bit more detail to you and help to discuss some of the things that we may not have included in the actual presentation. One of the first questions was, is ADHD recognized as a disability under the federal government for adults? And the answer is yes, absolutely. Whether you view attention deficit as a disorder or not, it is neurological. It affects how the brain concentrates or thinks, and it is considered a disability that impacts your ability to work, to provide for your own livelihood and the livelihood of your family members. Therefore, the Federal Americans Disability Act covers ADHD as a disability. The key here is, do you meet the qualifications? And it is a regular demonstration of those five symptoms that we talked about. What's the difference between ADD and ADHD? You'd be surprised to know that there is no difference. ADD, or attention deficit disorder, is an outdated term that is used for what we now call ADHD. It is a subset of ADHD. Some people with ADHD have the hyperactive behavior and some don't, but the diagnosis is still ADHD either way. Another great question was, are there state or government resources or any disability benefit programs for adults such as SSI or SSDI? Like any other mental illness that can be disabling, ADHD has specific signs and symptoms that must be documented in a disability claim. For adults, the Disability Determination Office will award either SSI, which is supplemental social income, or SSDI, Social Security Disability Insurance, depending on whether the individual meets the eligibility for the resources and the income. The medical evidence must be included to be primary proof of functional limitations. Like other mental illnesses, they must be documented via testing, statements, and or self-report that residual functional capacity is so limited that it precludes most types of work. That can be extremely limited and can be extremely difficult to prove at times. And for others, it's very easy. What are some of the considerations that would be reasonable to request or expect of an employer? That's an excellent question. Understanding what some of the tasks, such as taking the minutes of a meeting or reading a page of text, may be difficult, and you may need extra time to complete tasks. Allow and ask for plenty of time to read and complete tasks. There are other questions that were presented, and if you'll give me an opportunity, I'm going to go through some of those. The first couple that were asked, we've already answered, and they were: is it recognized as a disability? What's the difference between ADHD and ADD? Are there as- uh, what are any of the associated health or personal risk factors? We did touch on that during the presentation. Those risk factors can be inattention to detail, impulsivity, reacting without considering the long term effects of our actions. It can be impulsive buying. There are a number of risk factors that affect the livelihood of an individual with ADHD. Are there state or government resources? Yes, we've already addressed those. One of the questions was: my son stands frozen in one spot for a long period of time. Is this ADHD? He has also become almost nonverbal and shrugs to questions, but rarely speaks and is uninterested in regular activities outside of school. Is this ADHD? Symptoms of adult ADHD were discussed in our presentation. The recommendations are, though, if you suspect that an individual has ADHD, whether adult or child, the thing to do is seek medical attention. And that is usually through the consultation with your primary care physician, a psychiatrist, a psychologist, a neurologist. They are the individuals that can best help in diagnosing the condition. What are some of the considerations that would be reasonable for request? We just mentioned asking for more time. An employer can also support a person with ADHD by providing accommodations as a flexible schedule, a private workspace, noise counseling headphones, written instructions, breaks and time management strategies, assistive technology, accommodations for meetings, time management support, career counseling, and training. All of those things are reasonable requests of an employer, and those requests do fall under the American Disabilities Act. Another question: can adult ADHD be managed without medication? Of course, yes, adult ADHD can be treated without medications using psychotherapy, lifestyle changes, and support groups. Psychotherapy is the cognitive behavioral therapy that is designed to help a person make changes in their negative thought patterns and to decrease their impulsive behaviors. Techniques to help alleviate symptoms, signs to spot and trigger research, researching back information. Again, techniques would include the cognitive behavioral therapy, talk therapy, and being able to exercise mindfulness. Now, mindfulness is a whole different category of being able to focus on one's breathing, one's processes, one's body function, and one's environment. And it is becoming very popular as a source of therapy for individuals with ADHD. How does a person with ADHD recognize when they are in control and when they are out of control? To recognize when you are in control um, versus out of control is based on your physical sensations. An individual with ADHD should pay very close attention to their physical sensations, thoughts, behaviors, looking for signs of a racing heart, difficulty concentrating, impulsive behaviors or actions, heightened emotion, and a feeling of being overwhelmed. If these symptoms are occurring, that is an indication that the individual is not in control. Rational thinking and the ability to make deliberate choices suggests that you are in a controlled state. These were some excellent questions, guys. I have to commend you on some of these questions that are being asked. It says that you are thinking outside the box and that you are truly interested in getting answers about ADHD. Another question was, what are the most effective treatment options? Any lifestyle changes or coping technicians, any lifestyle changes or coping techniques that can help manage ADHD without medication are usually going to be helpful. Are there medications to help with focus? Yes, there are ADHD medications that focus in on the attention deficit portion of the ADHD, such as the hyperactivity and the impulsivity. These medications work to increase the level of chemicals, those that stimulate the neurotransmitters in the brain. It gives the body time to think through something before reacting. Not all medications are designed for every patient. You'll likely see an improvement in your symptoms with some ADHD medications, and some may work differently depending upon the type, the individual, the work they do, the environment that they're in. There are many, many factors that affect these neurotransmitters, but the majority of them include dopamine and neurodopamine inhibitors, which increase the amount of neurotransmitters, helping the individual improve their focus. What are the right doses of medications for an individual 50 years of age or older? Dosing of ADHD medications can vary amongst this age group depending upon how many of the factors are included and how many other health conditions the individual may have. Like medications of any kind, they are going to be specific to the individual and the individual's environment. Not all medications are going to work for everybody. And so, if the dosage isn't helping, no matter what the medications are, it's recommended that you talk with your doctor about the different medications, the effects these medications have had on you, and what your desired goal is with taking these medications. A big question that's been asked often is ADHD hereditary? While the actual cause of ADHD isn't clear, research concludes that ADHD is hereditary. There are both genetic and environmental factors that can affect whether or not an individual has ADHD and the severity of the disorder itself. I'm almost done with the questions, guys, I promise. Is it true that caffeine works the same as some ADHD medications? The answer to that is yes. Some studies have found that caffeine can boost the concentration for people with ADHD. It's a stimulant drug and it mimics some of the same effects as some of the stimulants that are taken for ADHD, such as amphetamine medications. However, caffeine alone is less effective than prescription medications are. What is the percentage between men and women? I was a little surprised to hear this, but men are slightly more likely to be diagnosed with ADHD than women are. About 5.4% of men are diagnosed with ADHD, and about 3.2% of women are diagnosed with ADHD. However, women are often diagnosed later in life. There's a strong association between having trauma in childhood and the development of ADHD. Is that correct? There is a strong association between having trauma when you're a child and the development of ADHD in adulthood. Some examples of these childhood traumas could include physical, sexual, or emotional abuse or neglect, seeing someone hurt your parents, being around drug use and drug abuse or mental illness in the home, losing a parent to death or divorce, having a family member in jail or prison. It can also include growing up impoverished or poor, living in a violent area, experiencing symptomatic racism and discrimination, being in a bad car accident, or having a life threatening illness. These have all been shown to be contributory to ADHD. I'm hoping that this presentation and answering these questions have given you more insight to what adult ADHD is, how it affects an individual, and the things that we can do to support and remedy ADHD in the future. Are there any additional questions that I can answer for you at this time?
Yes, we had another question. It is, what is the best way to disclose a late diagnosis to the employer in order to get accommodations?
That would be one, if you have received a formal diagnosis from a healthcare provider or counselor, it is to provide that documentation to the employer under strict confidentiality. Um, you can also use your performance evaluations. If you have had a history of tardiness at work, inability to complete projects, inattentiveness to detail, um, those things are actual documentable symptoms for ADHD. And therefore, if that is part of an evaluation based on the employer, that is evidence. Did I answer the question for you?
Yes, I think you did. Yes.
Okay. Any other questions?
Are there any, I don't see any unless somebody sends another one, but I do want to add a few things in there, Terry, if you're okay.
Oh, please do.
Okay, because I do have three boys that are all ADHD. Um, and I suspect that some of that came from me. So some of those things that Terry was talking about mindfulness, I do play meditation music for my kids at night to help them, and it helps relax whenever one of my kids with the ADHD starts having meltdowns because he's just overstimulated. Playing calming meditation music actually helps. It's surprising how much it just all this, he could have a moment and then all of a sudden you just see that difference in his demeanor with that calming meditation music. I play focus meditation music here at work. You can find them on YouTube. There's actually ADHD focus meditation music.
Yes, yes, there
So
are
there's
stations.
specific things that you can do. Getting your kids or yourself outside. What they're finding over the years is that we're spending less and less time outdoors. And so people that would have never been diagnosed with ADHD in the past are being diagnosed with ADHD today because they're indoors playing video games. They're in, and even though people say, well, yeah, but when we're playing video games, we're calm. It's, well, but your brain is being
Overstimulated.
overstimulated with those video games. And so as soon as you're done, you're all over the place. And so I actually have to limit those electronics throughout the week. Now that's obviously when you're on electronics during work, you can't limit that because you're on the computer. Um, but like TV, those sort of things, just
TV.
getting outside, walking in the park can help alleviate some of those symptoms from the ADHD itself. Um,
He-
those are some of the things that I have found that have
He-
helped
Heather, can I
with
interrupt
my
for just a
family.
second?
Yeah, we did have a question come through.
Okay, before we answer that other question, I wanted to bring up something that you may not realize. With the ever changing recognition of ADHD, you may have noticed that we're in an era now of adult coloring books. Those adult coloring books are designed to help memory, focus, and relaxation. And they were designed with the intent of helping people with ADHD, helping individuals with dementia and Alzheimer's. So, adult coloring books, art projects, and things of that nature also help. And as Heather was saying, involving yourself in things in the environment, gardening, fishing, um, just bird watching, those types of activities can help an individual to maintain that control and stability. I'm sorry, Heather, go ahead.
Oh, no worries. We do have another question that came through. Waking up in the middle of the night and not being able to go back to sleep because we start thinking of issues,
Hmm.
or what we need to do in the morning, work related things, other, our daily life activities and things that are happening. Would that fall under ADHD or more like stress and anxiety? Could or
Well,
both
it
maybe.
it can be both. It can be one or the other or both. And as we talked about, having attention deficit does affect your sleep patterns. It can affect your circadian rhythms. And so um, it's difficult to say which of those it is. But again, that would be something you would want to address with a healthcare professional. And one of the ways to help eliminate that is exactly what Heather was saying. Some of that um, relaxing music or ocean sounds have been another thing that has been recommended. Not necessarily music, but the sounds of the ocean. Um, I'm an individual that wakes up in the middle of the night thinking of all the things I need to do in the morning. And one of the things that was recommended for me, believe it or not, that really does help are wind chimes. I have a wind chime just outside my bedroom window, and that those wind chimes help me to sleep heavier and longer. Just the soothing subconscious hearing of that wind chime. Any other questions?
If you do have other questions, you can post them in the chat, or you can take yourself off of mute and ask the questions.
Not only questions, any comments. For any of you that are with us that feel like there's something you'd like to share based on your own experience with ADHD, we welcome your input. No?
Oh, I have one for someone. This I have a fail-safe list of activities ready to go when I feel overwhelmed, and it helps a lot. Oh, I like that idea.
I do too. That's a great idea. We find
And
that
so I
a
keep a paper and pen next to my bed.
right. It helps. It helps to get some of that out of your head. And for a lot of people, they feel like if I can write it down, I can release it. And so that is an excellent suggestion. Thank you
Usually
for that.
coloring books, guitar to play, brown noise to help writing and expressing what I'm feeling, or even workout or dance music.
Yes.
Um, is,
Now,
is
dance music sometimes, well, it depends upon the individual. Now, heavy metal usually is not what is recommended. A lot of violent lyrics, such as what you may hear in rap music, acid metal, rage music, some of that is not recommended because what it does, it intensifies the anxiety. It stimulates rather than relaxes. But things like jazz and classical music, nature sounds, those kinds of things can generally help. And dance, yes, dance can help. One, it's focused, it becomes part of muscle memory. So you're not having to concentrate on every step, which then again allows you to relax. Excellent suggestions, guys. Thank you.
one of the other things that I have found works for my family, because since everyone in my family apparently is ADHD. And that's one of the things the doctor had said is if one kid in my family had ADHD, majority of the rest, my chances are my other children would have it too, and they all do, some form or another. But I have to be cognizant of when there's too many people, when it gets overcrowded, that can be an overstimulation. So like
Right.
even birthday parties and things of that nature, I have to be careful of the time of day or or other events. And if there's just like if I take my kid to the museum, I know that I can go on a Sunday from 11 o'clock to 1 because it's not overcrowded. But starting at 1 o'clock, there's a line out the door. There's just too many people there at that point. So you start recognizing those symptoms and your reaction, or maybe even your kids' reactions to that overstimulation. So just monitoring yourself in different environments can help identify that too.
Oh, yes. Christmas shopping. I have a son that is adult ADHD, and Christmas shopping sends him into, I say a tizzy, but it just shoots his focus out of the water. He can't tolerate it. He doesn't like large crowds. He doesn't like the hustle and bustle. Um, and so, with that said, there's a consideration for the type of work that individuals with ADHD thrive in better than others. You know, working in the mall during the Christmas holiday is not the most opportunistic employment for a person with adult ADHD. Sometimes working in things like daycares, uh, the stressful environments cause overstimulation to begin with for all of us. And then for the individual with attention deficit hyperactivity disorder, that sends them over the edge.
There are some other comments that were made. If I wake up with something in my head, I write it down. Somebody else also asked, is multitasking a part of ADHD?
The inability to multitask is part of ADHD.
And then somebody else, I just wanted to add that I've learned that ADHD can be a cause of anxiety or depression. So
Yes,
if someone is struggling with that, it could also be a form of ADHD.
yes,
And
that is correct.
always talk with your providers about that too,
Yes,
because you're right. Managing ADHD helps reduce symptoms of anxiety and depression. I carry loop earbuds that cancel noise when I go to the mall, grocery shopping, or even out in the bar. And it's been a lifesaver.
wonderful. Yeah, one of the things that was mentioned here is the sound blocking earphones. Yeah,
And then somebody else, they have to have a series on at all times or they can't concentrate.
a series. I'm not sure I understood. Can you elaborate on that?
I'm assuming they're talking about like some kind of episode or something that listening through
Oh,
their earbuds,
I see. Okay,
TV.
I understand. Yes, yes.
I mentioned something about my role in connecting people. Yes, so I can help individuals with if they're needing help finding a primary care physician or even a specialist or somebody who does, for example, this ADHD testing in adults and children. I can help find those that are in our ACO network. So just let me know if that's something that you're what you're looking for. My email address is heather.williams@healthtexas.org. Or my phone number is 210-920-9301.
Heather, do you mind if I ask a quick question of you? Don't we have a couple of organizations that we are affiliated with that help with mindfulness, like um, Arasti?
So no, Rosty's not going to do mindfulness and they're not in the network. So we have there's Hands in Harmony
Hands in
that we work
Harmony.
with periodically that comes out and does at different employer groups and does massages and things of that nature.
Mhm.
But I would, if you're looking for mindfulness, ironically, you can probably do some research on chiropractic services as well, because that's what I did for one of my kids and found out that chiropractic actually can help get your body back in alignment and has shown results in getting for children with and adults with ADHD because I've started doing that for myself and my son. But on if you have Netflix actually has what's called Headspace, and they have mindfulness there as well that you can do different things there, and it doesn't cost you any more because it's on your Netflix um, already. So it's called Headspace. And I know my son's pediatrician recommended that for my son. They also, if you're trying to go natural, they also recommended like first thing in the morning having green tea because it has that caffeine in it, which helps, has the opposite effect for us that have ADHD, helps calm us
Mhm.
versus stimulating us. Um, but instead of having coffee, they're going do the green tea,
Right.
and then doing chamomile tea at night before bed.
Wonderful.
So and then getting outside, just having that outside time and with that greenery is very important for us as adults or kids with ADHD.
Guys, this has been a great interaction. And I certainly, and speaking for Heather and I both, we certainly appreciate your questions and your comments. And we encourage you at any of these talks to engage with us. So, one, you learn and we learn, and we can share what we have learned with one another. So, unless there's anything else, thank you for joining us. And I'm going to turn it back over to Heather.
Stop.